Welcome to your DSM-5 TR diagnostic cheat sheet. We are breaking down 10 core disorders into quick, actionable snippets for clinical practice and exams, focusing on symptom criteria and duration thresholds. Major depressive disorder, or MDD, is a clinical diagnosis defined by a persistent depressed mood or a profound loss of interest in activities for a period of at least 2 weeks. To meet the criteria, an individual must experience either a depressed mood or anhedonia, which is the inability to feel pleasure for the majority of the day. Hallmark physical and cognitive signs include chronic fatigue, diminished energy, and persistent feelings of worthlessness or excessive guilt. Remember the diagnostic rule. At least 2 weeks of persistent sadness combined with anhedonia is the primary indicator of MDD. Generalized anxiety disorder is characterized by excessive and uncontrollable worry about multiple life events. The diagnostic threshold requires these symptoms to persist for at least 6 months. Common clinical signs include persistent muscle tension, ongoing fatigue, and constant daily apprehension. Patients often report difficulty concentrating and sleep disturbances, which interfere with daily functioning. In clinical practice, focus on the pervasive nature of the worry and the 6-month duration. It is not just occasional stress, but daily apprehension that signifies GAD. Post-traumatic stress disorder, or PTSD, is diagnosed following exposure to traumatic events. The clinical presentation is structured around specific diagnostic requirements. A diagnosis requires exposure to actual or threatened death, serious injury, or sexual violence. Crucially, these symptoms must last for a duration of more than 1 month to distinguish the disorder from acute stress reactions. Core features include intrusive symptoms, like flashbacks and nightmares, as well as persistent avoidance of internal or external reminders. Patients often experience significant hypervigilance, marked by an exaggerated startle response and difficulty concentrating. This combination of reliving trauma while actively avoiding reminders is the hallmark of the PTSD diagnostic profile. Adjustment disorder is characterized by an emotional or behavioral response to an identifiable stressor occurring within 3 months of that stressor's onset. The symptoms are significantly out of proportion to the intensity of the stressor, and they lead to marked impairment in daily functioning. Crucially, these symptoms must not be better explained by another mental health disorder, and they typically do not persist for more than 6 months after the stressor or its consequences have terminated. Alcohol use disorder is defined as problematic alcohol use leading to clinically significant impairment or distress. It is characterized by an inability to stop drinking despite clear negative consequences. To meet the diagnostic criteria, individuals must demonstrate at least 2 of the following symptoms within a 12-month period. Key indicators include increased tolerance to alcohol, the presence of withdrawal symptoms when not drinking, neglecting major life responsibilities, and failed attempts to cut down or control alcohol use. Most importantly, this disorder involves persistent continued use despite recurrent physical or psychological harm caused by the alcohol consumption. Attention deficit hyperactivity disorder, or ADHD, is defined by a persistent pattern of inattention or hyperactivity that interferes with functioning or development. For children, 6 or more symptoms of inattention or 6 or more symptoms of hyperactivity and impulsivity must be present. Adults may require fewer symptoms. Key clinical requirements include symptoms being present for at least 6 months, an onset before age 12, and manifestation in multiple settings, such as home and school. Remember the hook: can't focus, can't sit still, and acts before thinking. Autism spectrum disorder, or ASD, is a neurodevelopmental condition characterized by significant challenges in social interaction and the presence of restricted, repetitive behaviors. The diagnostic criteria focus on specific pillars, starting with social communication. The diagnostic criteria focus on specific pillars, starting with restricted behaviors. The diagnostic criteria focus on specific pillars, starting with onset persistence. These symptoms are typically present in the early developmental period and can vary greatly in severity across the spectrum. Bipolar wine disorder is clinically defined by the presence of at least one full manic episode. The golden rule for this diagnosis is that mania is required. A manic episode is characterized by a distinct period of abnormally elevated mood lasting at least 1 week. Symptoms often include significant grandiosity, a severely decreased need for sleep, rapid racing thoughts, and distractibility, accompanied by an increase in goal-directed activity. Always remember, the hallmark of bipolar 1 is the manic episode, distinguishing it from other mood disorders. Borderline personality disorder is characterized by pervasive instability in interpersonal relationships, self-image, and affects. The core diagnostic features include deep-seated instability in how the individual relates to others and views themselves, paired with significant emotional volatility. Clinical signs often manifest as a chronic fear of abandonment, impulsivity in self-damaging areas, feelings of emptiness, and intense difficulty to control anger. Obsessive-compulsive disorder, or OCD, is characterized by the presence of obsessions, compulsions, or both, which cause significant impairment. Obsessions are recurrent, intrusive thoughts that cause anxiety, while compulsions are repetitive behaviors performed to reduce that anxiety. The core of the disorder is a cycle. An intrusive thought triggers intense anxiety, which leads to a ritualistic compulsion, providing temporary relief. Remember this key rule. Obsessions drive compulsions. The ritual is the attempt to gain control over the internal distress caused by the obsession. Understanding the required duration for symptoms is critical for accurate diagnosis. Here is a summary of the timeframes for major depressive disorder and generalized anxiety disorder. For major depressive disorder, the patient must exhibit symptoms consistently for at least 2 weeks. In contrast, generalized anxiety disorder is considered a chronic condition requiring at least 6 months of persistent and excessive worry to meet clinical criteria. Keep these distinct timeframes in mind, as they are primary markers for distinguishing acute episodes from chronic anxiety states. In clinical diagnostics, distinguishing timeframes is critical for accurate coding. Let us compare post-traumatic stress disorder and adjustment disorder. For PTSD, symptoms must persist for more than 1 month following the exposure to a traumatic event. This duration distinguishes it from acute stress responses. Conversely, adjustment disorder is defined by the onset of symptoms within 3 months of the specific stressor's occurrence. It reflects an inability to adapt to life changes. Remember, PTSD looks at the persistence beyond 1 month, while adjustment disorder tracks the proximity of onset to the stressor, specifically within 3 months. In the diagnosis of bipolar 1 disorder, there is a core diagnostic rule focused on the presence of mania. Crucially, a single manic episode is sufficient to meet the diagnostic criteria for bipolar 1 disorder. While major depressive episodes are very common in these patients, they are not strictly required for the diagnosis. Therefore, the defining feature that drives the bipolar 1 classification is the occurrence of the manic state itself. We categorize these into a mood cluster. First, major depressive disorder is defined by a duration of at least 2 weeks, featuring low mood or loss of interest. Bipolar 1 disorder is distinct because it mandates the occurrence of at least 1 manic episode, which represents a state of elevated energy. Borderline personality disorder is characterized by chronic instability in emotions, self-image, and relationships. Grouping these helps recall the unique diagnostic criteria for each mood-related challenge. To master these diagnoses, group them into the anxiety cluster. Generalized anxiety disorder is defined by 6 months of persistent general worry. Post-traumatic stress disorder requires at least 1 month of specific trauma-based reaction. Finally, obsessive-compulsive disorder is characterized by a ritualized response to intrusive thoughts. The neurodevelopmental cluster helps us group disorders by their core behavioral patterns. ADHD is defined by divergent energy, characterized by persistent inattention, excessive physical activity, and impulsive decision-making. In contrast, autism spectrum disorder focuses on the social and sensory experience. It involves primary deficits in social communication and social reciprocity, combined with restricted, repetitive patterns of behavior or specific sensory sensitivities. When evaluating a patient with anxiety symptoms, the clinical timeline is the most critical diagnostic tool. If symptoms emerge within 3 months of an identifiable stressor, consider adjustment disorder. This is a maladaptive response to life changes. Conversely, if the patient reports 6 months or more of constant, excessive, and generalized worry across multiple domains, generalized anxiety disorder is the more likely diagnosis. Distinguishing between PTSD and generalized anxiety disorder relies on the presence of a specific trauma history. Apply the trauma filter. Symptoms like hypervigilance or flashbacks linked to a violent, life-threatening event indicate PTSD. In contrast, generalized anxiety disorder involves excessive, pervasive worry about life stressors that are not rooted in a specific traumatic event. By checking if the core anxiety is tethered to a distinct index trauma, you can accurately differentiate between these two diagnoses. In clinical practice, when evaluating behavioral health, it is essential to systematically assess for substance use, specifically alcohol use disorder. A key indicator for alcohol use disorder is the pattern of continued use despite clearly negative social or physical consequences resulting from the behavior. When approaching clinical exams, always scan for the key timeframe first. Identifying the duration of symptoms is the fastest way to eliminate incorrect choices. For instance, if the prompt mentions symptoms lasting 6 months or longer, you can immediately rule out short-duration diagnoses like adjustment disorder. Use these timelines as a filter. If the clinical presentation doesn't fit the required diagnostic window, move on. This process of elimination is vital for high-stakes testing. Diagnostic integrity requires looking beyond the criteria list. Remember that DSM categories are clinical tools, not absolute definitions of a person. The essential step in any assessment is evaluating functional impairment. Ask yourself, is the patient truly unable to perform key tasks? Specifically, evaluate their ability to hold employment, participate in studies, or maintain meaningful interpersonal relationships. If there is no functional impairment, the diagnosis may be inappropriate. You have now covered 10 core disorders, their essential timeframes, and their hallmark signs. Keep this cheat sheet handy for your next shift or exam. Practice recalling one disorder per day to cement your diagnostic knowledge.